Welcome, everyone. My name is Melanie McGacken, and on behalf of the Rutgers Community Living Education Project team, I'm excited to welcome you to Optimizing Health Outcomes for Individuals with Intellectual and/or Developmental Disabilities, the fourth session of our Prioritizing Your Health and Wellbeing webinar series. The Rutgers Community Living Education Project, also known as CLEP, is a program through the Rutgers School of Public Health. The CLEP team can serve as a bridge for self-advocates and families whose loved ones are ready to explore various community living options within the state of New Jersey. CLEP is committed to taking a person-centered approach when providing community living resources for people with intellectual and/or developmental disabilities. The CLEP team's contact will be shared at the end of today's webinar. Before we get started, let's go over how you can best participate in today's learning event. Closed caption has been activated for today's webinar. To access or hide the closed caption feature, please use the Zoom toolbar on your screen. To ensure the highest sound quality possible, all attendees will initially be muted during today's presentation. We do, however, like to keep these sessions interactive. So to ask a question to the presenter or host, please use the Q&A option on your screen. And to interact with the other attendees of today's session, please use the chat feature in your Zoom control panel. Topic-specific questions will be addressed as long as time allows. And for consideration to all of our attendees, we encourage you to keep questions as general as possible. It's my pleasure to now introduce today's guest speaker, Ms. Laura O'Reilly-Stanzilis. Laura O'Reilly-Stanzilis is a registered nurse who holds a master's degree in management of public health and public policy. Laura has an impressive background. She is the founding president of Be Well and Thrive, a New Jersey nonprofit dedicated to improving health and wellness of people with disabilities. She is also the New Jersey Regional Director of Nursing for RHA Health Services. RHA provides services and support to adults and children with intellectual and/or developmental disabilities across New Jersey. Laura's previous professional roles include being the executive director of the North Jersey Health Collaborative, overseeing community health improvement planning in 5 counties in northern New Jersey, and the director of health and wellness at Easter Seals, New Jersey, where she managed health promotion programs for individuals with developmental disabilities in all 21 counties of the state. Without further ado, please join me in welcoming Ms. Laura O'Reilly-Stanzilis as she shares her insights on optimizing health outcomes for individuals with intellectual and/or developmental disabilities. Laura, welcome.
Thank you. Thank you, Melanie. Thank you, Rutgers School of Public Health and the Community Living Education Project for having me today. And thank you, all of you, for sharing your lunch hour with me. It gives me great pleasure to be here presenting to case managers, family members, people who work in the IDD field, and others. There's a lot that we can be doing together to enhance the lives of those we serve. And I am going to start with prevention, right? Routine screenings, healthcare, and health and wellness. Routine means something that's done on a regular basis. So not when we have symptoms, not when we're sick, but routinely with a primary care physician who we develop a relationship with, who gets to know our health needs and directs our care like a point guard would. Health and wellness, you hear a lot about health and wellness as a packaged entity, right? Well, health and wellness is about lifestyle activities and choices we make for our individuals served or that we make ourselves that help improve our health outcomes, to help reduce the need for certain medications, to help optimize our physical fitness and cardiovascular strength and the health of our body and our cells, again, through good nutrition and adequate hydration. Health care, as we know, is the care that we receive from our providers that guides our activities, that personalizes our own plans of care and how we live our life and how we manage our medications and how we manage, I want to say dis-ease as an unease of the body, right? Because a lot of dis-ease can be reversed and prevented through certain interventions. So we're going to cover a lot of things, and I'm going to move quickly over the next 30 to 40 minutes. And if anybody has any questions, please feel free to put them in the chat. This is interactive. Melanie will chime in if there are any questions that you want answered while I'm presenting on a particular subject. So the Surgeon General's call to action to improve the health and wellness of persons with disabilities was published in 2005. That was almost 20 years ago. That was 19 years ago. I always harken back to this because the call to action still exists and we still have a long way to go. We're making progress in inclusion and in focusing on an ability rather than a disability, and obviously ADA compliance in built infrastructure. But we still, again, have a long way to go because, as with the general population, individuals with disability are facing a high prevalence of chronic disease and obesity-related illness, lifestyle-related illness. And I'm going to read this for you because these are the words of the Surgeon General. At the time, it was Richard Carmona, who was our Surgeon General in 2005. With the recognition that disability is not an illness, the emphasis increasingly is on continuity of care, the relationship between a person with a disability and the environment at the physical, emotional, and environmental levels. That's where we live. That's where we work, right? The continuity of care is collaboration and communication among guardians and caregivers and support staff and case managers and healthcare. We all need to communicate. We all need to make sure that certain needs or responses or reactions or interventions are shared with other disciplines and other professionals so that we all have a holistic picture of the individual that we are advocating for or serving or living with to make sure that all of their needs get met. The approach is based on the knowledge that good health means the same thing for everyone. So if a person has a diagnosis of autism spectrum disorder or an intellectual developmental disability, that is a diagnosis on a cognitive or developmental disability, but the underlying health issues, the physiological and the biological health issues that people experience are unique to all individuals. And people with intellectual developmental disabilities, there are varying degrees of health or people who have illness or people who have chronic diseases such as heart disease or diabetes or any other illness that anybody would get. So good health means the same thing for everybody, whether or not they're experiencing a disability. And I bring this up in particular because oftentimes, perhaps if an individual with a developmental disability has to go and be seen in an emergency room or an urgent care center, and they're being seen perhaps because maybe there was an unmanageable behavior and an intervention is needed, and the behavior is an expression of an underlying health condition that is not able to be communicated. It's really important that we understand that communicating with and for and advocating for our individuals served is at the forefront of everything we do. And we want to make sure that all health needs are met and that they don't get dismissed as a diagnosis of autism and then they're discharged and then you're back at the doctor 2 or 3 days later addressing the same issue again because it hasn't been resolved. I'm going to talk a little more on that because that's really important for all of us when dealing with the healthcare profession or the urgent care profession to make sure that our individuals, and when I say our individual, I will refer to our family member, our consumer, our client, our individual served. The best advocacy is really making sure that these issues are addressed at the point of care and the staff in the healthcare setting isn't merely just discharging with a diagnosis of autism and the chief complaint that led you to the emergency room or to the urgent care. Inclusive community health promotion in preventing disease. Healthy People 2010, 2020, and now the United States and the state of New Jersey are working on Healthy People 2030. And Healthy People 2030 is putting social determinants of health and health equity at the center of that project, that planning process, identifying people in the community who may not have access to services, to programs, to care, to financial resources, and helping to address the root causes of poor health outcomes in various communities. What's interesting is that in the residential setting, for example, a group home setting, an individual lives in his or her own home, right, in a community setting that is managed by an agency that offers residential services with support staff. Oftentimes you have staff, they come and go on shifts, very committed and caring, but they're not rooted in the community, right? They're not part of the parent-teacher association, or they don't have children in sports, or they're not part of the senior club or the book club. So getting involved on the community level really helps the public health system and local government recognize that there are people in the community with special needs. And I'm going to talk more on that because that's, to me, an answer to a lot of the inequities in the community related to health promotion and people with disabilities. So there will be more on that, because the more we get involved in the community, the more the community know that we're there, right? That there are, they do go around and do census in town for certain things, but unless we represent the people that we serve to the entities that are doing the promotion and the activities and the recreation in the community, they may not know that we're there. And on the flip side, we are working hard. I did a project with Dawn Center for Independent Living, so you'll see stuff about them later on in this presentation. And we did a public health workforce training where we invited municipal leaders and public health leaders to educational webinars, which was part of Rutgers, by the way. Rutgers provided continuing education units for public health professionals who attended this training webinar. And our topic was looking to be inclusive of people with disabilities in health promotion. And inclusion doesn't simply mean, hey, you can come, you're welcome. Inclusion means recognizing that you have to have ability appropriate content, and you have to really reach out more and engage and make sure that you do understand, you meaning a community leader, what the needs are of people in the community and how you can best serve them. So committing to inclusion starts on the local level with ability appropriate health promotion programs. And there are some out there. There's a lot of grant funding out there for those of you who are in the nonprofit field, or those of you who are in the disability services field. There are grants for nonprofit agencies, and nonprofit grant-funded programs can also serve clients in the community who are involved in programs for agencies that are for-profits. The funding is out there. If anybody wants to reach out, I'd be very happy to have offline discussions afterwards about ways in which grant funding can be accessed and what that could look like in the community. Because on the day-to-day basis, building health and wellness and health promotion and health education promotes self-efficacy for the individuals served to have a lot of control over their own health and making decisions in their lives that improve their health, such as dietary choices and physical activity, and not having to pay for it. That's the thing. So if there is grant funding out there that can support these health promotion programs, I recommend that we keep our eyes open. A lot of them come from the Aging and Disability Services agencies. So this 42%, this is from the American Journal of Preventive Medicine in 2011. And the reason you'll see things from me going back to 2005, 2011, that's when I was really involved in promoting health and wellness for people with disabilities on a routine basis. That's when I'm very fortunate to have had a career in this field since that time. And I've been using a lot of the same information because a lot has not changed. And then recognizing that we still have a long way to go, I realize if I can use this data that goes back to 2011 and state that we really haven't seen a positive change and all of us together can make the difference in moving the dial here. While I was putting this together, I was on the Lakeshore Foundation and the National Center for Health, Physical Activity and Disability website, NICHPAD, which I will talk about them too. They have new data from like 2016, and it says 50% of American individuals with disabilities are obese, and that's more than 13%. Well, 42% is more than 13% higher than people without disabilities, and 50% is even higher, right? Maybe 17, 18% higher. So the dial actually has moved in the wrong direction. A lot of people rely on medications for, to control symptoms of medical issues. And a lot of those medications have side effects. So that is even an indicator of a greater need to do the healthy lifestyle interventions that can reduce the prevalence of obesity in the population served. People with disabilities have a greater incidence of chronic illnesses like diabetes, hypertension, high cholesterol, and other health-related complications. Again, back to the American Journal of Preventive Medicine, not much has changed in that area. If we look at what's going on in the general population, if we look at what's going on in our bodies, in our families, chronic disease is prevalent, and a lot of chronic diseases, as we know, preaching to the choir here, can be prevented. But what I want to talk about is how we can come together to make those changes. We all know that if we eat better and we sleep better and we exercise on a routine basis, we will be healthier. But my goal here is to show you ways in which we could collaborate across disciplines, how, guardians and case managers and support staff and advocates can come together to, again, work across disciplines to help to optimize health outcomes. Preventing medication errors and safe administration of medications is a team effort. Those of you who work in service of individuals with disabilities in day programs and residential programs, and even in healthcare settings and medical homes, know that medication is a big part of health management. It's a big part of health management in our senior population. It's a big part of health management in our aging adult population. As we get older, our blood pressure goes up, our cholesterol goes up. There are a lot of things that change with our bodies as we age. Well, think about our friends and family and clients with disabilities. Their bodies are changing the same way my body and your body is changing, right? And that means more medications. And then, of course, behavioral health is another factor, and there are a lot of behavioral health prescriptions as well, psychiatric medications. That's a lot of medications, right? So if you think of having all of those medications in our body and our body having to metabolize those medications, so those medications are really working to target the symptoms that they are prescribed for, it's important, equally important, to have adequate hydration and nutrition to keep that medication assimilating through our body and being digested and metabolized into our cells so that they work for their intended purposes. Nutrition support is key to this, right? If we're having adequate protein and micro and macronutrients in our diet, our muscles and our connective tissue and our skin, everything that is part of good health is healthier on the inside and out. So again, I cannot underscore how important it is, whether or not you're on a medication, to eat healthy and get adequate hydration, preferably with water, as opposed to a sweetened drink or any other kind of drink that might be high calorie. Safe administration of medications is a team effort. If you are a family member or a guardian or a case manager, and you periodically review the medications that your individual served or your family member is on, you might see some changes. Understanding the medications, understanding their intended purpose, understanding any potential side effects helps keep the client safe. The state of New Jersey has training for direct support staff through the College of Direct Support, and agencies train their staff in medication administration, keeping in mind that these staff who are administering the medication are not medical professionals. Now, I as a nurse, part of my role is to do that kind of training to help support staff really understand how to do safe administration and look for side effects. And that's an ongoing thing. And agencies such as the one that I work for are very diligent about making sure that their staff is well supervised and adequately trained and demonstrate proficiency and are routinely monitored in doing so. But it is a team effort. Families, case managers, residential day supervisors, direct support staff, nursing teams, we have to be communicating. And if you notice anything isn't changing as a result of a medication or there are side effects, report it immediately. The pharmacist is your best friend. If you ever have a medication question, call your healthcare provider or the pharmacist. Chances are, if you call the healthcare provider and it's 7 o'clock at night, you may not reach them. You might get their voicemail or their service. But your local pharmacy in your community, your CVS, your Walgreens, they're there wherever you fill your prescription. If you ever have a question, you pick up the phone, you talk to your pharmacist, you ask them questions. You missed a medication. Can I take it or should I wait? If you work for an agency that's contracted with a pharmacist, you call the contracted pharmacy. Pharmacists are really good advisors on medication. Never make an assumption that you can give or hold a medication if it was not given as scheduled. Always do a professional consultation with the healthcare professional and your pharmacist. Keeping everybody safe is, again, one way to optimize health outcomes, and certainly a way to avoid something that could turn in the wrong direction. And if anybody has questions, please put them in the chat. I will be happy to take a pause and answer any questions directly. Seeing none, I will move on. So as I said earlier, each individual is unique and has different set of needs and means for achieving those needs. What's good for me, for my personal regimen, may not be good for you. So what's good for one of our individuals may not be good for another family member with a disability or an individual served by your agency. We are all unique people. The same way you or I, certain mornings may not want to get out of bed and go to work because we're not feeling well. Sometimes, your client in a residential setting may wake up feeling a little under the weather or not so enthusiastic to go to their day program or out in the community or to work. So we really have to continuously understand that, again, people with or without a disability all have unique needs. We all wake up in the morning. Some days we feel better than others. So, we have to use our empathy skills to make sure that we are really communicating well and acknowledging the health needs of our clients. Improving the health and well-being of a community must ensure that every individual has access to and benefits from the policies, systems, and environmental changes enacted on behalf of community improvement. So going back to the community health improvement plans or Healthy People 2030, on the local level, all municipalities, counties, and health departments are required to be inclusive, if not through the Americans with Disabilities Act and the built infrastructure, but also in other ways. Are their educational materials ability appropriate? Are those who are hearing impaired or deaf or visually impaired or blind, are they being accommodated through special applications so that they can be included in education processes? The more we ask, the more we bring it up, the more we bring it to the attention of our public systems, the more change we all as advocates can effect. Sometimes the policy systems and changes are not applied equally to every member of the community. They may not know you're there, right? So they build a new health department and they widen the doorways for wheelchair access. They put in tables, examining tables that can be lowered to the ground for an easy wheelchair to table transfer. So physically, we are making the changes. But if there's somebody in your community, in your family, in your agency who has a special need, who wants to go to a public screening, you have concerns about them, having behaviors. Public health is also very aware of the need for trauma-informed care. Communicating ahead of time can help communicate with a healthcare provider or a recreation director in the community, or a YMCA leader where they have special needs programs, or a public health educator. I will be coming today and we have some clients, and it's not like you're putting a spotlight. Hey, everybody, look at our clients. We want you to know that they have special needs. We want you to know that they have special needs because they have the right to have access to the same programs and services as anyone in the community. So we are approaching you in a collaborative way to say, we have some individuals coming, and we want to let you know that we're really interested in getting involved and engaged in your programs and your recreation, in your health education programs. And can you help us? Do you have any questions? How can we accommodate you? How can we support you? How can we support each other? Communication, 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 closing the loop always, right? Some examples of inequality could be inaccessible public or government buildings. But like I said earlier, that's changing with new construction codes, right? Guidelines for physical education classes and physical activity are not equally applied to students with disabilities. I will get into that a little more, but that's really important because people with disabilities and mobility limitations still need exercise. We still need to have some kind of a movement, whether it's passive movement, where somebody assists with the movement, or whether it's supported with somebody helping with balance or using an assistive device. We need to move the body. We need to use the muscles. We need to have range of motions on our joints to get circulation going through our body, to increase our heart rate so our heart works more efficiently to pump blood through our bodies. So every body needs exercise. And of course, I say this, never start a new exercise program without consulting your personal healthcare provider, because there could be unique things for a unique individuals that you need to look for. If somebody is a diabetic and they're on insulin and they're exercising, how does that affect their glucose? If somebody has problems with their joints, is there anything you need to do beforehand or afterwards to keep them safe? I could go down a long list, but each individual is unique. So always address physical activity with a healthcare provider, right? There are medication side effects that you have to be aware of for body temperature being elevated. I'm not saying this to throw a monkey wrench in getting exercise or to serve in any way, shape, or form as a deterrent to exercise. I am saying this just to ensure that we are always working safely. And again, I keep saying the word unique. We're all unique. We all have unique needs. And lots of times healthcare systems don't understand the special needs of patients with disabilities. I had mentioned that at the very beginning of my presentation. So the more collaboratively we can work with healthcare systems, the better outcomes we will have. If you again, are in an emergency room or in an urgent care center, make sure that the person who is accompanying the individual with a developmental intellectual disability is well apprised of their health background. If you have a binder with the information and behavioral notes and healthcare history and medication record, you can go with information so that the healthcare provider at the point of care can really understand and look at the background, right? But the more you know about the person that you're caring for, and the more information you can impart on the healthcare provider, the better outcomes we're going to have, right? And achieving outcomes is a process. You know how we say, it's not the destination, it's the journey. Well, it's what we do routinely. It's how we handle our healthcare, how we handle our health communications, how we administer medications, how we apply nutrition and exercise to the life, and stress management. Back to accessibility. Public spaces such as parks, playgrounds, and trails that are not fully accessible can be made more accessible if you bring a voice to it. If you contact your county parks department and say, we noticed that this trail isn't accessible for people with disabilities. Is there another trail that you can put in that we can, take our individual family members or clients on a nice walk through the woods, or wheel somebody in a wheelchair, or get through here with assistive devices? People are becoming more and more aware of it, but as the eyes and ears in your community, if you bring this need to the attention of your county officials or your municipal leaders, they can include access to parks, playgrounds, and trails for people with disabilities. Public transportation, a lot of people who are served by agencies have transportation provided for them. Sometimes out in the public, there are drivers, bus drivers who don't understand how to operate the system. Now that's an organizational thing on their part. But, the more we speak up, the more we bring things to the attention of people who are in leadership and in management of these systems, of these agencies, the more they know, the more they can help us. Quality healthcare. So access to care with individuals with IDD may be more complicated depending on health insurance. That's a common one, especially when the client is on a managed care program, managed care with Medicaid, managed care organizations, or an HMO, Medicare, Medicaid, and Medicare. Private health insurance even isn't always accepted at the same place, right? You find when a new year comes, or you have new insurance, or your spouse changes insurance, you realize that the physician you've been seeing for 10 years doesn't take your insurance, and then you have to change physicians. People who are provided insurance through Medicaid have more limitations and more restrictions, but there are databases where you can look up providers who accept Medicaid. A lot of urgent cares are accepting. They don't all accept the same. Some will accept Horizon, some will accept Aetna, some will accept all. So it's really a good practice to call ahead to urgent care centers and ask them, what insurance do you take? Are you contracted with CMS? Which are you taking? And just keep a list of the urgent care centers in your community and see what insurances they do take, so that if you get there at a time where you can't take your family member or client to the doctor, you don't show up and they say, oh, we don't take your insurance, right? So it's a little, you do a little footwork, but it's worth it in the long run. So you might have a client who has Aetna, you might have, I said this, someone who has WellCare, or one who's on Horizon, and two different urgent cares take two different sets of insurance. It's really good practice to ask to speak to the business managers at these urgent care centers and healthcare centers and say, hey, I just want to let you know that we live in your community, or we have programs in your community. We have, X amount of residential homes for our clients in your community, and we would love to frequent your facility as well. We don't want to frequent urgent care in the frequency sense. We would like to have access to your urgent care should the need arise. How's that better, right? Should the need arise, we would like to be able to utilize your services, but you don't take our insurance. And then that is an impetus for leadership at an urgent care center or a health center to start exploring their contracts and who they can do business with, so that they could better serve the community, because they are there to serve the community. And if they realize that they're not serving the entire community, they can make internal business decisions to expand which insurances they accept. So again, this is families, guardians, case managers, residential program managers, people who advocate for people with intellectual disabilities in the community. Just think of the change we could all make if we pick up the phone and we start talking to the business managers at these healthcare centers and say, we have needs that are not being met in the community. Can you partner with us and help us have better access? It can be done because I've done it, and so can you. We can all do it just by speaking up. Emotional health is another key thing to pay attention to. Social stimulation, psychosocial wellness, isolation, depression. Just like any of us, like I said, we wake up on any given day. Some days we're just not up to it, you know, and somebody with an intellectual disability can experience insomnia, depression, fatigue. And then in addition to the psychological and emotional well-being, just like the rest of us, people with intellectual developmental disabilities can face weight challenges, diabetes, irritable bowel syndrome, and digestive problems, including constipation. Constipation is a big issue. If you're not moving a lot, if you're not getting enough fiber in your diet, if you're not well hydrated, you are prone to constipation. So add to that a medication that may slow down intestinal or bowel motility, where your bowel is not as active as it normally is because of a side effect of a medication. We have to be aware of that. It's very important to monitor what comes out of the body as much as we monitor what goes in the body, right? It's health professionals, you know, we're always, you know, ready to look at, you know, what someone in the family leaves behind, much to their dismay, because we want to see what's coming out as an indicator of what health status is. So pay attention to the output and frequency of bowel movements. Just like if somebody goes into the hospital to have a baby, they don't discharge you until you have a bowel movement. If you go to the hospital, sometimes they want to see that you've had a bowel movement. If you're able to address it, you can and you do. But if a person with an intellectual disability or a person who is not able to communicate it, hasn't had a bowel movement in a couple of days, how would you know until they're uncomfortable and then you're starting to realize it? So very, very important to monitor bowel habits. I know it's lunchtime, everyone, but this is so important, right? What goes in and what comes out are the indicators of what our health outcomes could be. So because this slide does talk about irritable bowel, which is a hyperactive bowel versus a slower bowel. And of course, there are other stress-induced illnesses that can manifest in the form of a rash or hair loss or, you know, agitation, physical manifestations. Stress is everywhere. We all experience it. So do people with intellectual and developmental disabilities. So we have to be aware as well that if we're agitated and we're stressed, that might rub off, they be picked up by the people that we serve, right? So when we're working one-on-one or in groups with clients with an intellectual disability, we set the tone, just like we set the tone in our own households, right? If we come home from work and we're agitated and mad and got stuck in traffic, the rest of the family feels the stress. If we come home happy and whistling, it rubs off on the household. Same thing for the people we serve, right? So some of us, we might serve our clients in the work setting, even though it's work to you, it's home to them. And I have the really good fortune in my work to go into some of these homes, and they are happy homes. I went into a home last night and I smelled what the staff was cooking for dinner, and I almost invited myself to sit down and eat. We have the privilege to create a happy home environment for the people that we serve and for our family members with a disability and without a disability. And I'm going to take my own advice, by the way, and keep the tone happy. Healthy lifestyle and ability appropriate physical activity and stress management, they're the cornerstones of health and wellness in quotations, right? Because health is health and wellness is wellness, and you are as healthy as your lifestyle is. And if you feel good and you have unhealthy lifestyle behaviors, sooner or later it will catch up as we age. So healthy aging starts today. Healthy aging for an individual with a disability starts today. What we do today affects our future health outcomes. Diabetes management, medication compliance, immunization, preventive care and screenings, routine health care. Routine is something that you do on a usual basis. If your doctor says, come back in 3 months, here's what I want you to do. Try this, come back in 3 months, let's get some lab work. Do it. Partner with the doctor, right? If you are working on behalf of an individual with a disability, right? Everybody gets their annual physical, right? But that doesn't mean you cannot be seen in between your annual physical. Working in partnership and communication with the doctor really helps all of us have the best outcomes. I want to get over here to diabetes management. So somebody is diagnosed with diabetes and they get their blood sugar checked routinely. They get their standard dose of insulin, or they get insulin to scale based on what their blood sugar reading is before meals and at night. And then the insulin is given. In addition to that type of diabetes management is nutrition. Nutrition is key because some people are on an insulin protocol where you look at how many carbohydrates they've consumed, and then the insulin gets administered based on the amount of carbohydrates to scale. But what if those carbohydrates were healthy carbohydrates? What if it was oatmeal and whole grains? What if there was more protein in the diet? So the reason I bring this up is with any medication, with cholesterol lowering medication, with blood pressure medication, with diabetes medication, having the medication, we are so fortunate that we are in a time in history where we have such great medical care and pharmaceutical interventions, but lifestyle interventions can reduce the need for certain medications for certain individuals. So if somebody's blood sugar is within normal parameters, then they may not need that extra insulin. And there's a possibility that through lifestyle with type 2 diabetes, in certain cases, you can reduce the need for insulin. And this is all stuff to be communicated with the doctor. And when you see a doctor for any kind of chronic disease management, ask, well, what can I do with my diet to help change this? What can I do to lower the cholesterol so that I don't have to take 10 milligrams and we can cut it to 5? Because remember, everything that goes into the body has to be metabolized through the body. So even if you're still on a medication, if you're taking a smaller dose of the medication, it's improvement, and it's better for your body. It's better for your liver. It's better for your kidneys, right? So keep that in mind, that yes, sometimes you have to stay on a medication. And we're very fortunate that there are medications to help control such symptoms. But healthy lifestyle can reduce the dose. And again, that all comes out to optimized health outcomes, less side effects. So breaking down barriers to screenings. Oftentimes, it's very difficult for gynecological screenings, mammograms, colorectal cancer screenings. But as we all know, there are guidelines, and after a certain age, we should all have routine screenings. Individuals with disabilities may have difficulty with following the directions. So of course you need family members and support staff to assist in any prep or any diagnostic processes where you have to be screened. comorbidities, if there are, issues with other health issues, they could interfere with the ability to get screened. Fear is a big one. Sensory, the noises, if you've ever had an MRI, you know what that sounds like. It sounds like somebody's hammering outside the machine. Touch sensitivity, communication. So it's recommended that we as family members, as providers, as guardians, as case managers, when we're working with our clients and our family members on getting screenings, we need to have patience. We need to understand that there is fear involved. I hate getting a mammogram. I do it. I have to, but I think it's one of my least favorite things to do. I get fear when I have to have certain screenings, but I do it because I know that I have to do it. So when we're doing this for a person with a disability, we have to really be empathetic and supportive, make sure the fears are communicated with the providers or the diagnosticians, and communicate and talk about the procedure. Sometimes you may even be able to call ahead and say, can we do a little tour? Can we come in on one day so I could show, I'll just say Mary Jane, okay? So I can show Mary Jane the facility where we're going to come next Tuesday so that she knows what we're doing. And this isn't done frequently, but it can be done if you ask and you explain why. That's how we break down the barriers, through communication, through letting the providers know that there is an unmet need and you could help us meet this need. And of course, I always say this, use your primary care physician as the point guard. Make sure that any screenings or any specialist appointments, that it's all through your primary so that your healthcare isn't fragmented and that there's one person who's taking ownership of your case. I'll call my healthcare a case, right? Or we'll call your family members or your clients' healthcare. One person who gets all of that information into one system and can look at all of the parts that make up this one person. That's a whole person approach to care. Not just you go to your primary for your physical, or you go to the endocrinologist for your diabetes, or you go to the cardiologist for your hypertension or hyperlipidemia, but do it through the gatekeeper who is your primary provider. And then you have one person to sit down with and communicate with about all of the different health needs, the unique health needs of the unique person served. Colorectal cancer screenings, again, talking to your doctor is really the best way to determine what screenings there are. There are non-invasive fecal immunochemical tests and Cologuard. Centers for Medicaid and Medicare Services has determined that there's enough evidence for them to cover Cologuard testing. Local offices of public health do that as well. Again, always do this under the guidance of a primary care physician, because this is not for anybody who has a family history or a intermediate or high risk for colorectal disease or cancer. So always under the advice of your provider. Your provider may say, Mary Jane is a candidate for the Cologuard, so then you just provide a stool sample and not have to get the colonoscopy. I am not telling you that this is what is right for you, your family member, or your client. I'm telling you that this is an option that your healthcare provider, your client, your family member's healthcare provider may recommend if they feel that it's right for your family member. So, one barrier down. Rutgers Cancer Institute of New Jersey, we recently did not recently, it was 2 years ago, I was the host of an extension for community healthcare outcomes, Project ECHO. And it was an 8-week series where we had professionals talk about ways to break down the barriers to care for people with disabilities and to break down barriers to screenings. We have really great presenters on here. We have Deb Spitalnik from the Boggs Center. We had the late Bev Roberts from ARC of New Jersey. We have 2 practitioners from Atlantic Health Center for Developmental Disabilities. And we had myself as a presenter, and we had a couple of nurses who work directly in the field with individuals with disabilities. I think it's a really wonderful resource. Melanie, if you could share this link for people to use these resources, it could be very helpful, considering our role is to optimize health outcomes, and it starts by breaking down those barriers. Confidentiality is key. You know, sometimes a client with an intellectual disability may feel uncomfortable by somebody who's at a visit with them. And they may not tell the provider everything that they want to say because they want privacy. So that's something we want to be aware of, and that's something we want to make the provider be aware of so that they can have open, honest conversations with their clients. Okay, a little joke in here, but imagine, I'm going to tell you a story. My dad at 84 had to go to the emergency room, and I was sitting there with him as his daughter, a nurse, and his advocate. And an emergency room doctor came in and started asking my dad about his sexual history. And I went, la, 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 la. I said, I'm sorry, I have to leave the room. I'm leaving the room. I think my dad's entitled to have a private conversation with you. Everybody, we're all entitled to privacy, because if the doctors and the nurses and the PAs, if they need information about us and we want to be honest with them and we need to do it in private, we need to have our privacy respected, and also the privacy of our individuals served. So if they're not able to articulate what it is they need to say, a most trusted person should be the person in the room with them, not just any staff member, right? Again, chronic disease starts with a healthier lifestyle, and I'm preaching to the choir. We all know what we need to do, but I want to talk about how we can do it. So I hope I keep making that point, that through communication, through interdisciplinary collaboration, through advocacy, we can all make a difference. Health programs, health promotion programs make a difference. These programs are available. Keep your eyes open. Look at your local Center for Independent Living, your CLEP. They can guide you to where programs exist in the community that can provide health education for individuals with disabilities so that they can make good choices for themselves and start introducing foods into the diet that they may not ordinarily eat, but through these health promotion programs that have reward incentives, they can be inspired to make new choices. Wellness is not simply the absence of disease. Wellness is mental health, physical health, emotional health, spiritual health, financial health, safety in the community. So there's a whole lot that goes into being well, and we all, again, have the privilege to help make that happen for individuals with intellectual developmental disabilities. Small changes go a long way. Replacing sweetened drinks with water cuts excessive calories and reduces the consumption of unhealthy beverages. Another great resource, Choose My Plate, myplate.gov. It's the USDA website. They have all kinds of diets, diet guidance, recipes, how to eat healthy with heart disease, eating healthy on a budget. Really important. A lot of people say, oh, I can't eat healthy because I can't afford healthy food. Well, you can get a frozen bag of vegetables and keep that, which have a really long shelf life. I'm not going to do a nutrition lecture, but I just want to tell you that there are resources out there through grant-funded initiatives, also through insurance for people over, I want to say over 65, who are on Medicare, who have a diagnosis of prediabetes, may be eligible for registered dietitian services that are paid for by the insurance company. Remember, baby boomer population will be the oldest population and the largest elderly population ever on the planet since the history of mankind. And that includes our friends and family with disabilities, right? So healthy aging starts today, and there are lots of resources that are free. So the registered dietitian through grant funding or through insurance with an indication, a referral from a primary care physician related to a diagnosis, or choosemyplate.gov. Lots and lots of resources for yourself, for your staff, to better serve your clients. For your clients, some of our friends and family with disabilities and intellectual disabilities cook for themselves. So we can get them more involved in their own process of meal planning. Exercise, I'm preaching to the choir, so I'm going to move through this. Exercise is good for your health. Here are some resources. The American Council on Exercise has an exercise instructor certification program for experienced certified exercise instructors in partnership with the Special Olympics. They're doing a special needs certification. When I saw this, I was thrilled. The YMCA has aquatics program. The Rowan University has the Get Fit program. And I point to this, the ICE accreditation. I would just like to, it's bragging rights for my great team. When I was at Easter Seals, New Jersey, Be Well and Thrive was the program that we managed. And we became accredited through the Institute for Credentialing Excellence, which also at the time was the credentialing agency for the National Board of Nursing. So it was a very high standard that we had to meet. So our Be Well and Thrive exercise program and health education program became the first ever accredited program in the United States for people with disabilities. And hence, the years have passed and the fee-for-service model came into play. Easter Seals, New Jersey, my former employer, they gave me the rights to Be Well and Thrive. That's why I'm the founder of Be Well and Thrive. So Be Well and Thrive, the program, is now Be Well and Thrive, a New Jersey nonprofit. So with the work that we had done, and we knew what it took to become accredited, when I recommend that people do exercise in the community, for people with when I recommend people with disabilities taking exercise programs in the community, I recommend that they do it with a credentialed agency. Commit to Inclusion is the National Center on Health, Physical Activity, and Disabilities campaign. Great resource. Dawn Center for Independent Living has a guide to health and wellness that has all of your, well, for Morris, Sussex, and Warren County at least, but we also have state and county health department information on here for you to find your local health department and partner with them on community health promotion. And again, the National Center on Health, Physical Activity, and Disability, tremendous resources. Thank you for your time. I hope that you can take any 1 or 2 or 3 nuggets away with you and help make the lives of those we live with and serve healthier. Thank you.
Laura, thank you so much for sharing all this valuable information. On the screen right now, you will see the Community Living Education Projects, the Rutgers CLEP's contact information. My name is Melanie McGacken. My supervisor Natalie's number is up there also, as well as the rest of our team's email contacts. Feel free to take a screenshot of that slide if you need any assistance in community living options or exploring possibilities. We're here to help. And Laura, I see that we have quite a few questions coming in.
Okay, now I know we're at time. Could everybody hang on for 3 minutes?
Yes, listen, I'm able to, and we will
Okay.
record these. So if someone does have to hop off, please feel free to access the recording. If you asked a question, we will try to get to some of the more general questions, if possible. Laura, I'm not sure if your area of expertise is in all these areas, but let's see if you have some resources. In the Q&A section, we have the first question asked is, can you discuss how to obtain palliative care for individuals with IDD, intellectual developmental disabilities? NJ Family Care Medicaid recently added palliative care as a benefit, this individual sharing. This would be incredibly helpful for people in self-direction and also in group homes. At-home clinical supports are so badly needed in these settings.
Okay, so I'm going to nutshell this because my answer is going to be general. I would start with your local healthcare system. I mean, you could just do a Google search. There are, and I want to separate hospice care from palliative care, but a lot of hospice care agencies do palliative care. Your local healthcare system, I would start with that, because most local healthcare systems have a visiting nurse service. So your visiting nurse service, your local healthcare system, and your primary care provider. Okay, because your primary care provider, again, should be the person who helps to direct that. Insurance is an issue, but it usually is for everybody. So your healthcare system, just ask the operator, do you have a palliative care department? And even your care manager, your managed care organization, you may or may not know this, but you have case management as a service provided by CMS.
Perfect, thank you. Quick question, who is RHA Health? If someone is asking.
So RHA Health Services, it might be someone from RHA. RHA Health Services is a company headquartered out of North Carolina. They have we have programs, residential and treatment programs and day programs in North Carolina, in Georgia, in Pennsylvania, and did I miss a state? Tennessee, I think, and New Jersey. And I am the nursing director for New Jersey. And RHA came in less than a year ago, and they acquired 2 companies in New Jersey. One was Broad Step and one is Broadway, and RHA Health Services is the new company replacing those 2 companies.
Okay. And we have some really specific questions. If by all means you're not comfortable, not an area of expertise, please feel free to say so.
I certainly will.
Perfect. And just so that today's attendees know, unfortunately, sometimes we have to ask multiple follow-up questions to one question to really get to the root of what you're asking. We are not here to provide any medical advice,
Yes.
but we will be able to give some resources and general information if at all possible.
Yes.
The next question is regarding nutrition and the client or individual's rights. How do staff and nursing, etc., get individuals to eat a healthy prescribed diet? A lot of the clients refuse and will tell the doctors they will not follow.
Okay, that's an interesting question. I can only speak on my experience over the last 15 years and what I've observed. Like any of us, if somebody told you you can't eat a piece of chocolate cake for the rest of your life, I don't know that I could go with that. So basically, introducing new foods, and just continue to try and work with the physician, because the physician may order some kind of a dietary supplement. I am not diagnosing or prescribing or giving medical advice, but I'm just giving you some examples of how a healthcare physician may guide this. If you notice that somebody is not making those adequate nutrition choices, then that needs to be communicated with the primary care provider, and then the primary care provider can make suggestions either in the dietary realm or advise on perhaps any kind of meal supplement with nutrition. But that's just 1 or 2 things that could be advised. But again, never substitute anybody's advice for that of your personal healthcare provider.
Absolutely. And Laura, I think it's having really open and honest communication between the individual and the caregiver, whether that caregiver is a family member or a direct support professional, to have that really open and honest communication with the doctors, right?
So,
This is
also with meal planning, involve them in the meal planning process, but also introducing new things, right?
Yeah, and I think if a doctor is prescribing a very specific diet, to have that conversation of these are all really unpreferred things, right? How can we maybe start with adapting some of the things that the person enjoys to incorporate healthier choices, right? So if the person loves bread, I'm making this up, obviously. Well, how do we get a multigrain bread into that person then?
Right.
You know, and again, very light example, I'm sure, compared to some of the diets being prescribed. But how is there a way to do that in steps so that person becomes more comfortable with some
And
of the foods being introduced also?
that's where a registered dietitian
Yeah,
is extremely valuable, because the registered dietitian might say you could have that one piece of white bread, just not 5 pieces of white bread,
yeah.
right? So
And it,
that's where, again, I'm going to stay in my lane. Yes, I have been certified in nutrition, but I'm not a registered dietitian. And it's not one size fits all. So with the primary provider and a registered dietitian, you can come up with a strategy. I mean,
exactly.
some of us, have had kids who, lived on bread for 3 years, and you wonder how they they grew into adulthood.
Yeah.
But, there are
And
other ways to get nutrition into the diet.
absolutely. And again, that open communication is so vital, right? To make sure that you're being connected with the right professionals to help provide you with some guidance and resources in hopes to make that as successful as possible. There were a few other questions in the chat. One is someone sharing an active 33-year-old semi-independent son, shops for his own groceries, makes unhealthy choices, higher fat, higher sugar. Parents are constantly reminding him to up his vegetables and protein, no self-discipline, no health diagnosis yet. Any suggestions?
Okay. Again, a registered dietitian, there are creative ways. I don't want to say play hide the broccoli, but there are creative ways. Okay, so if the person is independent and preparing their own meals, um, can you substitute the butter can you put olive oil, extra virgin olive oil instead of butter? Can you, make small tweaks to it? Again, a registered dietitian is your best advisor, because I don't know what medications the person is on. I don't know what other underlying health conditions there are, but a registered dietitian, even a consultation, is worth it.
And we have a few more questions. Let's just get to one or two more. I see it's almost 10 after. Would you happen to have suggestions on how to obtain quality mental health care? Give me 1 second. The screen, people are sending lots of thanks to you, but it's moving my screen down. Let me just get back to that.
And
Yes, we
another
do
thing, if
have.
you wanted to put an FAQ list together, send me the questions. We could put together something that you could send out.
Perfect. Perfect. Absolutely.
But the mental health.
Yes. So, would you happen to have suggestions on how to obtain quality mental health care? There appears to be a shortage of therapists and behaviorists working within the DDD system. Many private MD or PhD providers do not accept any insurance plans and do not have experience working with the intellectual developmental disability population. Any suggestions?
So I have to say that I couldn't agree more, because lots of times individuals are seen by a psychiatrist who are prescribing medications. If you're talking about psychotherapy and therapeutic mental health services, you're right, because you need both in some cases, right? So here's what I would say. I would say there are two agencies. There's MHA Aspire. They used to be the Mental Health Association of Morris and Essex, and now they're statewide, and they're called MHA, Mental Health Association Inspire. That's one resource. They have a website with lots of resources. Their director, Maydeen Despine, if you look her up, I now have to call her and tell her that I'm shouting out to her in webinars. But if you just go to MHA Inspire or the Mental Health Association in New Jersey. So there's the Mental Health Association and there's the Mental Health Association in New Jersey. Those are two. And then, of course, our Department of Human Services website has a lot of mental health resources. I know it outside of DDD. It's a complicated issue, and mental health is very important to all of us. and insurance sometimes imposes limitations. So just start with those two agencies that are out there every day working to destigmatize mental health care, and share your concerns with them, because this could be a new avenue for them to pursue in their advocacy work as well.
Absolutely. And I know that individual also mentioned for behaviorist within their question. I would strongly recommend, we at the Community Living Education Project firmly believe that the professionals within our community and other family members and the people we are connected with most who have similar lived experience are often some of the greatest referral of services for families. So reach out to your support coordinator, reach out if there is a school involved or a day program involved, if there is a provider agency of any sorts involved, to get any suggestions of referrals, right? Quite often they're serving multiple families, if not hundreds of families. Have they seen or, have families who have experienced positive relationships with behaviorists in your area, right? It's worth getting a name. And it's worth asking. So if
Yes.
there's any resources that we can help you with at the Community Living Education Project, again, our contacts are on the screen. We don't necessarily have all the answers, but we'll definitely try to find some resources to point you in the right direction.
Understanding how fatiguing and exhausting it can be to constantly seek services and only to find that they're not covered under the insurance, or there are a limited amount of providers. So yes, the Rutgers Community Living Education Project is your resource.
Okay. Laura, thank you so much again
Thank you.
for spending so much time with us today,
Thank you.
giving your time and sharing your expertise in this area. So often we hear presentations and they're all valid, but repeating the same topic, and this is not spoken about enough. So thank you again for sharing with us today.
Thank you.
If anyone has any resources, any needs, please feel free to reach out. We will do our best over the next week to get out a copy of the live recording. We will send that link out. I'm going to say by next Thursday at latest, hopefully earlier. I'm usually better than that. But as we're preparing to say goodbye today, you're going to see a brief survey pop up on your screen. It takes about 30 seconds. It's information that you provide us that will allow us to better serve the community moving forward. So if you would take that 30 seconds, would be greatly appreciated. If you have any specific topics that you would like to hear about, please feel free to reach out to me. And I guess at this point, we will say goodbye. So thank you everyone for joining us. And Laura, thank you again.
Thank you all. Thank you very much, Melanie.
Thanks.
Bye-bye.
Be well, everyone.
Enjoy your day. Bye.
Bye-bye.